Here is an in-depth and detailed profile of amineptine, covering all 13 aspects as requested. 1. Generic name, drug class, drug forms, brand name. Generic name, amineptine, drug class, atypical tricyclic antidepressant, TCA, primarily a dopamine reuptake inhibitor with some noradrenergic effects. Drug forms, oral tablets, typically 100 milligrams, brand name, Servector. Most common, previously marketed in France and some European countries, also known as Misiptil in some countries. 2. Definition. Amineptine is a psychostimulant-like antidepressant developed in the 1970s and classified as a tricyclic compound. It is distinct from typical TCAs due to its dopaminergic activity, which helps enhance mood, alertness, and drive. It was mainly used for the treatment of major depressive disorders characterized by psychomotor slowing, fatigue, and loss of motivation. Although it had rapid onset and beneficial effects on mood and cognition, amineptine has been withdrawn in many countries due to concerns over abuse potential and hepatotoxicity. Mechanism of action. Amineptine's action includes selective dopamine reuptake inhibition. Inhibits the reuptake of dopamine at presynaptic neurons, increasing the level of dopamine in the synaptic cleft and enhancing dopaminergic neurotransmission. Weak norepinephrine reuptake inhibition. It slightly enhances noradrenergic activity, but not as significantly as dopamine. Minimal serotonergic effects. Unlike other TCAs, amineptine has little to no effect on serotonin reuptake. This dopaminergic mechanism makes it energizing, improves psychomotor activity, and enhances pleasure and motivation, making it effective in atypical or melancholic depression. 4. Indications. Approved indications. Major depressive disorder, MDD, especially effective in depression with psychomotor retardation, fatigue, anhedonia, inability to feel pleasure. Off-label or historical uses, dysthymia, depression resistant to other antidepressants. All 5. Contraindications. Amineptine is contraindicated in the following conditions: known hypersensitivity to amineptine or any tricyclic antidepressant, history of drug abuse or dependence due to risk of addiction, severe liver impairment or liver disease, concomitant use or recent use of MAO inhibitors within 14 days, bipolar disorder may trigger manic episodes, pregnancy and breastfeeding, not enough safety data, severe cardiovascular disorders or arrhythmias, history of epilepsy or seizure disorders. 6. Before taking this medicine, precautions. Inform your doctor if you have or had liver disease, as amineptine is hepatotoxic in some cases, mental health conditions, especially bipolar disorder, schizophrenia, or psychosis. Substance abuse history, since amineptine has addictive potential, heart problems, especially arrhythmias, seizure disorders due to seizure threshold lowering, allergies to antidepressants or excipients in the drug, pregnancy or breastfeeding, not recommended. General precautions. Avoid alcohol. It increases CNS side effects and liver toxicity. Regular liver function tests, LFTs, are recommended during use. Avoid driving or operating heavy machinery until you know how the drug affects you. Use caution in elderly patients. #7. How to use. Take by mouth, as prescribed, preferably at the same time each day. Swallow the tablet whole with water, with or without food. Do not crush, chew, or break the tablet. It is usually taken once or twice daily, depending on the dose. Important, never self-adjust the dosage. Do not stop the medicine suddenly without medical advice due to withdrawal risk. 8. Dosing information. Adults, typical dose, start with the 100 milligrams per day, single morning dose, can be increased to 200 milligrams per day, either as a single dose or divided. Maximum dose, 400 milligrams per day, rare under strict supervision. Elderly, begin with lower doses, e.g. 50 to 100 milligrams per day, increase cautiously due to higher risk of side effects. Note, long-term use requires periodic liver function monitoring due to hepatotoxicity risk. 9. Missed dose and overdose. Missed dose, take the missed dose as soon as remembered. Skip the missed dose if it's near the next scheduled one. Do not double the dose to make up for a missed one. Overdose symptoms: agitation, confusion, restlessness. seizures, hallucinations, irregular heartbeat, arrhythmias, respiratory depression, coma or death in severe cases. Action: call emergency services or poison control immediately. Supportive care and monitoring are necessary in a hospital setting. Stop or avoid taking. Stop taking amineptine and contact your doctor if you notice yellowing of the skin or eyes, sign of liver damage, develop rash, itching, swelling, or breathing difficulty, show signs of mania, aggression, or psychosis, experience seizures or fainting, you are pregnant or planning to conceive, there's any sign of drug misuse or dependency. Do not suddenly discontinue without doctor guidance. Tapering may be necessary. 11. Side effects. Common side effects: nervousness or agitation, dry mouth, headache, tremors, sweating, palpitations, insomnia, nausea. Less common side effects: increased libido, weight loss, irritability, increased blood pressure. Serious side effects: liver toxicity, hepatitis, jaundice, liver failure, drug abuse or dependence, psychosis, hallucinations, mania or hypomania, seizures, allergic reactions, rashes, urticaria, angioedema, blood disorders, rare, leukopenia, thrombocytopenia. 12. Vital information. Amineptine was withdrawn in several countries, e.g., France in 1999, due to hepatotoxicity, abuse and dependence potential, not available in the United States or United Kingdom. Prescribing is restricted or banned in many regions. Should only be used when other antidepressants fail. Requires liver monitoring every 2 to 4 weeks during treatment. Its stimulant-like effects contribute to misuse. 13. Other drugs that will affect amineptine. Avoid concomitant use with MAO inhibitors, risk of severe hypertensive crisis or serotonin syndrome. Alcohol increases CNS depression and hepatotoxicity. CNS stimulants, e.g. amphetamines, increases excitatory effects. Hepatotoxic drugs, e.g. valproate, acetaminophen, additive liver damage. Antipsychotics, e.g. haloperidol, antagonistic dopaminergic effects. Antiepileptics, increased seizure risk. SSRIs or SNRIs, increased risk of serotonin syndrome or additive CNS effects. Always provide a full list of current medications to your doctor before starting amineptine. Conclusion: amineptine was an effective antidepressant with a unique dopaminergic mechanism, useful in psychomotor retarded depression. However, due to its serious risks, especially liver toxicity and abuse potential, it has been withdrawn from the market in many countries. It is no longer considered a first-line treatment for depression and should be used only under strict medical supervision when other treatments fail. Thank you. Have a nice day.